Assalamualaikum everyone, I hope all of you are doing well. In this video I'm going to talk about an anatomy of the humerus. So as you all know that the humerus is a long bone which connects the scapula to the radius and ulna. So the humerus is divided into three regions. One is the upper extremity, the body or the shaft, and the lower extremities. So going to talk about on the upper extremity. You can see over here the upper extremity is a hemispherical head, the neck, the greater tubercle, the lesser tubercle, and the surgical neck of the humerus. So if you see the head is a hemispherical. You can see over here, and it is directed medially, little bit backward and upward. So this head is hemispherical. It is not fully spherical, it is a hemispherical. So this head is articulated here to the glenoid cavity of the scapula, and it forms a joint which is called a glenohumeral joint, or the another name for the glenohumeral joint is the shoulder joint. So if you see just below the head, there is slightly constricted area. You can see this slightly constricted area. You can see the slightly constricted area is called anatomical neck of the humerus, and the anatomical neck of the humerus is more prominent below. You can easily appreciate at the lower of the circumference of the head of the humerus, then above the circumference of the head of the humerus. So this constricted area, you can see over here, this constricted area is called anatomical neck of the humerus, and thus provide attachment for the capsule of the glenohumeral joint. The capsule of the glenohumeral joint is attached here. So this anatomical neck actually separate the head from the tubercles of the humerus. Now if you see, there are two tubercles. You can see this is the greater tubercle and this is the lesser tubercle. The another name is the greater tuberosity and the lesser tuberosity. And if you see the greater tuberosity, there are three flat impression. One is here, this is superior facet, and the other is here, this is the middle facet, and the other is here, this is the inferior facet. So the superior facet provide attachment side for the supraspinatus muscle. This middle facet provide attachment to the infraspinatus muscle, while this lower facet provide attachment to the teres minor muscle. Now if you see the greater tubercle, you can see over here there is a crest. You can see over here, this crest is called a crest of the greater tubercle. It is called a crest of the greater tubercle, and this crest provide attachment to the pectoralis major muscle. Now if you see, there is another tubercle. You can see this is called lesser tubercle. This is called a lesser tubercle, and there is a crest on the lesser tubercle. This crest is called a crest of the lesser tubercle, and you can see over here there is a groove in between these two tubercle. This groove, you can see this groove, which is more deep and narrow above, while it is broader and shallow below. This groove is called a bicipital groove. The another name of the bicipital sulcus, or the another name is the intertubercular groove. So in this groove, the long head of the bicep muscle along with the anterior circumflex artery goes inside the joint, and the long head of the bicep muscle then attached to the supraglenoid tubercle. You can easily appreciate the supraglenoid tubercle here just above the glenoid cavity. Here the long head of the bicep attached. Now rest of the lesser tubercle provide attachment to the latissimus dorsi muscle, while the lesser tubercle here provide attachment to the subscapularis muscle. Now if you see, just below this tubercle there is slightly constricted area. You can see over here this constricted area just below the tubercle is called the surgical neck of the humerus, and thus in this surgical neck is the frequent site for the fracture of the humerus. And this is important because the posterior circumflex humeral artery along with the axillary nerve are wound around the surgical neck. So whenever the surgical neck is fractured, there is chances of injury to the posterior circumflex humeral artery in the axillary nerve. So the another part of the humerus is the shaft of the humerus, or the another name is the body of the humerus, which I will discuss in another video. So thanks for watching the video, and don't forget to subscribe, like and share.